Hey guys, it's Erica and welcome back to my channel. If you're not already subscribed to my channel, make sure to go ahead and click that red subscribe button and click the bell so you'll be notified every time that I upload. So today I had an awesome idea of creating an imaging modalities video for you guys. You guys are constantly asking me about all the different types of medical imaging out there, from X-ray to CT to ultrasound, and a lot of times you guys get confused about being a radiologist versus being a rad tech and just all the different imaging modalities out there. So I thought it'd be a great idea to just kind of break down all the different imaging modalities that I'm aware of and to explain it to you guys from the best of my knowledge how each one works. So I hope you guys enjoy this video and I hope it's very helpful and it helps you guys decide what exactly you guys want to be or if any of these imaging modalities are right for you. And I hope you guys enjoy it. Let's go ahead and get started. Okay, so the first imaging modality that I'm going to talk about, of course, is going to be X-ray. You might also hear radiologic technologist, rad tech, X-ray tech. These are all kind of synonymous with each other, but what you won't hear is radiologist. A lot of you guys are getting confused with a radiologist and a rad tech. A radiologist is an actual physician, probably attended school for about 12 years, maybe longer, and their job is to read every single imaging modality. They also perform a few different exams like things called thoracentesis, paracentesis. I'll get into that when we get into ultrasound. And they perform fluoroscopy procedures that are in X-ray as well. And I'll talk a little bit more about that later. But basically, like I said, radiologist is a doctor and they have nothing to do with being a rad tech. So get that one out your head. So we're gonna talk about a rad tech. So X-ray in general deals with radiation waves or X-ray waves. And basically what they do is when they hit the body, they absorb and then they go onto the picture or the film or the image that you're gonna see. Now if they're very dense like bones, it's gonna show up white, and if they're less dense, it's gonna show up black. Things such as like your liver and soft tissue and things like that. Now if you have very bad kidney stones, they might show up white on the screen. If you have very bad gallstones, they might also show up white on the screen, but for the most part we're looking at bones here, and we're also able to look and pick up things like emphysema and different conditions of the lungs show up kind of nicely on X-ray as well. So in order to be an X-ray tech, you have to attend a radiologic technology program. Usually it's about 2 years. My school went down to 4 semesters, but after you add the prerequisites, it's still about 2 years. So definitely check that out. And your job as a rad tech will be a lot of different things. You'll be doing babies, you'll have the elderly, you'll have in the middle, you'll have chest X-rays that you might have to go up to the room and perform what we call a portable, and you put the machine into the room, you put a board behind the patient's back, and then you shoot the X-rays into their chest, and of course it develops the image, and you take that back to your radiologist, and then they read it and tell the patient what's going on. You might also have people who are going to come into your department and have X-rays done there. Everything from your skull down to your feet, to your toes can be X-rayed. It's pretty awesome. So X-rays deal with radiation, what we call KVP and mass. KVP being the penetrating power and mass being the amount, and it all has to do with patient's body habitus. If they're really big, you're going to give them maybe more penetrating power, less mass, or it's all types of different math in that. I probably said that wrong, but all types of different math that you're going to learn as a rad tech that I'm not going to get into in this video because it's too much to explain. But basically you're just going to have to figure out how much mass to give a patient depending on their body and how large they are and different things like that. You're going to learn different types of positioning on how to X-ray the brain, not even the brain, but the skull itself, different positions on how to X-ray the shoulder and the abdomen, and they're going to teach you all those different types of things. You'll also have a few special procedures called fluoroscopy, which is a live ultrasound. It's a live X-ray, and they usually use this to do like a small bowel procedure and see, they give you this white pasty stuff called barium, and they'll watch it go through your bowels and they'll let you know if it's going through the way that it's supposed to. They also do lumbar punctures, and they'll use the fluoroscopy machine, and then they'll puncture and take a little bit of a spinal tap and test that. They do myelograms and kind of see if you have any slip disc and things like that in your back. A lot of different procedures go on in fluoroscopy and in X-ray that a lot of people don't know about, and it's pretty awesome. So that's all I'm going to get into for X-ray. I could go on for days. There's so much about it, but I wanted to just explain to you guys how it works. And also what we're concerned about with X-ray is the fact that there are some biologic issues that could happen because you're giving somebody doses of radiation, so it's important that you shield and protect your reproductive organs and things like that when possible. And they will also tell you all about radiation safety when you get in the program and just explain it to you. But just know that it's very important to be safe when you're dealing with radiation, and it's very important to follow all the different rules to keep you safe, like protecting your eyes, because if you're exposed to it for a very long years, you can get cataracts. People have gotten leukemia. People have had very bad problems because of the radiation. So it's very important to follow all the rules and make sure that you're protected. And if you're protected, it can be a great and safe job. So the next modality is going to be CT, or computed tomography. Basically, CT is also involved with radiation. Honestly, it gives you a lot of radiation, as one CT could be equal to about 200 chest x-rays. And that's why people are very particular about giving people CTs. They always try to send them to another modality first because it's just a lot of radiation. But it's an awesome test because it picks up so much more information than an x-ray ever would, or sometimes even more than an ultrasound ever would. They pick up a lot of information, and they're a very important imaging modality. So even though it gives off a lot of radiation, sometimes it's essential to find out the problem. So it's a pretty cool modality. So basically how it works is the patient lays on a table and they have what's called the gantry, or the x-ray tube, and it rotates very quickly around the patient depending on what area we're looking at. A lot of times it's the brain, it could be the chest, it could be abdomen or pelvis, and it'll rotate around that super quick, picking up slices of information as it goes on. And then on the actual image that you get on the computer, you will see the whole body, pretty much. Whatever image that you're looking for, you'll see all the different details. You can see kidney stones, you can see masses, you can see the liver, you can see the pancreas, you can see pretty much every single thing that you'd want to see. Now MRI, of course, is going to give you even more detail, but this gives you a lot of detail, and it's a pretty awesome modality. So basically, as a CT tech, I'm not a CT tech. I've rotated through CT as an x-ray tech, so all I can do is tell you guys what I've seen. And they do some procedures with contrast solution, which is a solution that goes into the body and shows up white on the image, and it'll highlight different areas. A lot of times it could highlight a mass, or it just might highlight some different areas in the body that they want to see, and that's usually done intravenously through an IV. And sometimes the patients come up with an IV, sometimes it's your job to put the IV in yourself, which is pretty cool. I love sticking people, so do the IVs yourself, and then put the contrast inside their body and let it flow. It's your job to control everything behind the scenes. So you're controlling what part of the body is being scanned, you're controlling how much radiation that they're getting, you're putting in their body, their height and their weight, and like you're kind of like the mad scientist behind the scenes, and you're behind a glass wall, and then the machine itself does everything that you put in, the machine like acts it out for you. So it's kind of like a brainy type of thing, in my opinion. A lot of people think that they're button pushers, and yes, in a way they are a little bit of a button pusher, but they have to have a lot of knowledge to push those buttons. You got to know how much of this to give. Sometimes it's timed, so you might have to it's very hard to explain but basically some pieces of the CT scan might be timed, so maybe 30 seconds of this, and then you're gonna go ahead and give the contrast, and then I can't even get into that right now, but it's a pretty cool modality. You have to go to x-ray school before. It's my understanding that you have to be an x-ray tech before you can move on to CT, that is an additional modality. And it's like that because they're both dealing with radiation, and you need to know your foundation before you can move on to the heavier stuff. So that's CT. Okay, so modality number 3 is going to be radiation therapy. This is a very popular one. People love to get into radiation therapy. Even when they're in x-ray school, they're like, I want to be a radiation therapist. It's pretty cool, and it's definitely part of our x-ray. So if you're going to do radiation therapy, you definitely need to have a foundation in x-ray or rad tech, radiologic technology, whatever you want to call it. You're going to have a background in that before you can enter into radiation therapy. So basically radiation therapy is used to treat different types of cancer. And if you don't know, I'm about to tell you that radiation itself kills both the healthy cells and the damaged cells or the cancerous cells. So it's very important as a radiation therapist that you are aiming straight at the cancer to try your best, to the best of their ability, to treat just that cancerous cell. So that is kind of what the job of a radiation therapist is, administering that radiation to those specific areas where the cancer lies, trying your best not to damage any of the healthy tissue. So it's kind of a hard thing to do, but they have made so many different types of contraptions and different things. I hate to say contraptions, but they are. I don't know if you guys have seen Grey's Anatomy. You guys know I love that show, but way back when, they had a lady on there who had brain cancer, and Amelia Shepherd was treating her, and they showed the radiation, and they put like a mask on her head, and that's how they kind of administer the radiation to her brain to make it go straight to the brain and prevent it from going anywhere else. And they have different types of contraptions, I hate that word, but contraptions again, that they put on different people to put on the different sites where they want to treat, if that makes any sense. So as a radiation therapist, you will be administering that radiation. It's a hard job for some people to just be around people with cancer, just because, not because they have cancer, but just because it's sad on them just to see them suffering and stuff. So it just really depends on what type of person you are and if you can handle that type of environment. It's definitely an awesome field to explore and maybe shadow somebody and see if that's something that you would like to do. Okay, so the next modality is going to be magnetic resonance imaging, or MRI. MRI uses very strong magnets and radio waves to create images of the body in immense detail, like amazing detail. Now, when I say amazing, I mean like joints, your ACL if you tore it, your meniscus if you've torn it, your blood vessels, spinal cord, brainstem, like itty bitty intricate details that you might not pick up on something else. You're definitely probably going to pick it up on an MRI. It is amazing, but it's very dangerous because the MRI is so strong. People have actually died in MRI machines. Now, it's been a very long time since I've been in MRI, but I do know that there are certain steps to getting into an MRI room. Like maybe the first room you can wear certain things, the next room you got to change out, the next room you need to take this stuff off. Like it's out of my range because it's been such a long time, but I know that there are certain steps to getting into an MRI room because there are certain oxygen tanks, certain beds, and certain things that can be in an MRI room. I've been in an MRI room with my bobby pins in my hair, and they actually tried to lift and leave my head because the magnet was so strong. And basically a person was inside of the bed of the MRI machine, and a oxygen tank that wasn't meant to be in there flew, hit him, and they died. And this has probably happened more than one time. So it's very important that you follow all the rules of the MRI machine, that you're wearing what you're supposed to wear, that the machine, like the equipment that's inside the machine, is the right equipment, because it can be very dangerous. Now, MRI, like I said, is magnetic resonance imaging, very strong magnets, has nothing to do with radiation. And because of that, it's my understanding that you can just have an associate's in MRI. You don't have to go to a rad tech school before. That's my understanding. I've seen it, but that's my understanding. Like I said, I've seen a lot of different MRI programs that are just MRI, and basically probably because it has nothing to do with radiation, you can just skip to MRI. Same as with ultrasound, it has nothing to do with radiation, so you can just skip to ultrasound. So if you would like to be an ultrasound, if you would like to be an MRI tech, you can go ahead and be an MRI tech without having to go through any other outlet to get there. This was definitely a rambling modality, but I'm not very familiar with the job of an MRI tech, but I've been in the room before and seen them work, and usually it's kind of a little bit like CT in the fact that you're back there pushing a lot of different buttons and setting things up and exposing them to the magnet that they're supposed to have. And I know the MRI takes a lot longer, as a CT scan might take maybe 5 to 10 minutes. I've seen MRI scans take up to 40 minutes, and I've seen lots of MRI techs reading great books back there. So it might be a great field for you. Definitely make sure to shadow somebody. I always tell you guys to shadow, because you never know what you're gonna like until you see someone else do it and see what a typical day for them is like. So that is MRI. Okay, so modality number 5 is gonna be nuclear medicine, or what we like to call nuke med. So basically what they do is they use radiopharmaceuticals. They rather inject it or give it orally, and their body emits radiation, and what's called the gamma camera picks up the radiation and gives you an image on the screen. So it's kind of cool. It's a little bit creepy. I've never really been interested in nuke med like that. I've learned a lot about it in school, and I've seen it done a little bit in the hospital, but basically what it does is it emits, your body is emitting radiation, certain types of radiopharmaceuticals. You can't be around children for a certain amount of time, and it's able to show you if there's different types of cancer in your body. It's able to show you metabolic processes, such as a HIDA scan will show you how the gallbladder is working, and there's just a lot of different scans and different procedures that you can perform with the nuclear medicine scan. I don't know a lot about it because it's not a field that I was interested in or one that I've seen a lot, but it's definitely very, very cool, and one of those that you definitely want to research for yourself, or definitely shadow, like I always tell you guys, and see if that's something that you would be interested in. But just to recap, like I said, radiopharmaceuticals, which is like a pill form of radiation or injected form of radiation, and your body emits that radiation. The gamma camera picks it up and gives you an image that will show you if there's types of cancer in your body, if your bones are breaking down, different types of things. And that's also just really, really cool. It's using radiation, so you're definitely gonna have to go to a rad tech program and then move on to be trained in nuclear medicine after that. Okay, so last thing we're going to talk about, of course, is my modality of ultrasound, which I love. Ultrasound uses very, very high frequency sound waves, higher than our ears can hear, and they go through the body, they hit different tissues, and then when they come back, they project a different shade of gray or black. So things like cysts, things that are filled with fluid, will show up black on the screen, and things that are a little bit less dense might show up as gray, such as your liver, and things that are very dense might show up white, such as the kidney stones that are in your body. So it's very, very cool to look at. It's totally abstract, because a lot of people look at an ultrasound and they don't know what they're looking at. And I think the more that you get into the physics of ultrasound, the more you understand that when these sound waves hit this certain part of the body, this is how they show up. You can kind of picture everything on the screen. To me, when I see an ultrasound, I know exactly what I'm looking at. And some people just say it's like an ultrasound, like a sonographer's eye. They're just able to see it. But I think if you look closely and you kind of just know what's going on and how everything works, you can definitely see the picture that I can see. But it's just really, really cool. So sonography, or you might hear, that's another one, you might hear ultrasound, you might hear sonography, sonographer, ultrasonographer, so many different names for it. And a lot of people just have so many different names for it, but all of those are synonymous with each other. They all mean the same thing. You're all doing ultrasounds or performing ultrasounds. Now, we look at a lot of different things. We don't usually look at the skull unless it's a baby. When it's a baby, we can look at the skull and we can see if they have a brain bleed. We can see, of course, a fetus in all of its different forms and shapes. We can see the thyroid and if there are any goiters or giant knots. I guess I can call a goiter. For people who have never seen a goiter before, it looks like a giant knot on the thyroid, and a lot of people will have like a thickened thyroid. You can see what we like to call a thyroid storm, which shows you if they have like hyperthyroidism or something. It's amazing to see. I'm gonna put a picture up here because it's so freaking cool to see a thyroid storm. You're like, what? It's so awesome. But yeah, so you have thyroid storm. Then we can look at the breast and see if there are any lumps or bumps in the breast. We can see if you have any fluid on your lungs that might need to be drained. We can look at the abdomen, the pelvis, for your ovaries or uterus. We can look at your testicles and see if there's anything going on there. We can look at the veins and arteries in your arms and in your legs. There are so many different things that involve ultrasound that people have no clue about, and it's very awesome. Like, I love ultrasound because it is a harder modality in my opinion. All those other ones are very hard in their own right, but in my opinion, I love ultrasound because I feel like I'm constantly searching for something that someone else might not be able to see, and I'm constantly looking for something. Like, it's just a really cool idea that you're like the one looking for something. So that's why I love ultrasound so much. But yeah, so ultrasound. So in order to be an ultrasound tech, you have to find an ultrasound program. They do have 4-year bachelor's programs, and they also have 1-year certificate programs, which is what I went through because I was already a rad tech. I just wanted to add on to it, so I did the certificate route. And they also, I believe, have associate's programs as well that are really good. And like I said, there are different types of ultrasound. You have your fetal ultrasounds, or OB. I'm an OB sonographer, so I specialize in babies in OB. You have what's called fetal echo, which looks at the baby's heart, all the different chambers and valves and things of the baby's heart, which is pretty awesome. You have nasal bones, which look at the nasal bones. If you are missing your nasal bone, sometimes that's a sign of Down syndrome and different things, and they kind of train you in how to look at the nasal bones. And that's usually a certificate, just an add-on to someone who's already an OB. Fetal echo is usually an add-on to someone who's already an OB. Another one would be vascular, and that would be looking at all the different the veins and the arteries inside the arms and the legs. We have what's called reflux studies to see if your artery, like the valves, open and let blood back through and back. It shouldn't do that. It should stay closed, and if it refluxes back, that's a problem. We do little different arterial types of tests. They might be ready to amputate, and we might need to like look at the arteries and stuff and make sure everything's working the way that it should. Test different pressures out. I mean, there's a lot that goes into the vascular portion of that. What else do they have? They have what's called echocardiography. This right here seems to be a modality in itself, because there's ultrasound, and then usually echocardiography is something that you add on to your degree of an ultrasound tech. Like, I know nothing about echo. I know nothing about your heart, and that usually you can go to a school just for echo. So we'll make that like the last modality is echo, because literally you don't usually learn it in your general sonography courses. Echo is like a separate entity, and like you're learning about the valves, the chambers of the heart, every single thing that the heart does, and you're able to find different birth defects and congenital defects and things like that, and help them treat those, and keep an eye on those, especially for infants and things like that. That goes back to fetal echo. But yeah, so there is so much that goes into ultrasound, and it's pretty cool. So that is it for this video. I hope you guys enjoyed it. I had a blast making it. I didn't realize how much I loved imaging until I created this video. It was so much fun to describe all the different imaging modalities out there, and it's so amazing to see the inside of a body and know that you were a part of it, and you can scan the body and find different things. It's really cool. It's awesome. So I hope you guys enjoyed this video. I hope you guys learned a lot. I hope you guys have a better understanding of the imaging modality that you're interested in, and I hope you guys are encouraged to go out and shadow and just see what is out there, like see what the world has to offer when it comes to like the medical field and stuff, because there's just so much out there that you don't know about that's so interesting, and it might just really like pique your curiosity. Like, you might just enjoy it so much. So make sure to research for yourself, check things out for yourself, and just find what you like. And I'll see you guys very soon. Like, rate, comment, and subscribe, guys. Bye.